Your medication might be changing who you are, not the disease. The pill you take every morning. Doctors don't always warn you about this. Here's what's happening inside your brain.
SSRIs are the most prescribed antidepressants in the world. Zoloft, Prozac, Lexapro, they work by increasing serotonin levels in your brain. That's the chemical linked to happiness and mood. For many people, SSRIs save lives. They pull you out of a deep depression. They stop the constant loop of negative thoughts. But here's the catch. For up to 80% of users, SSRIs cause emotional blunting. That means you don't just feel less sad. You feel less of everything. Joy feels muffled. Love feels distant. You stop crying at funerals, but you also stop laughing at jokes. Your partner says you seem flat. You're not depressed anymore. You're just nothing. The medication turned down the volume on all your emotions, not just the painful ones. If this sounds familiar, talk to your doctor about lowering your dose or switching to a different class of antidepressant. Not all of them work the same way.
Beta blockers are commonly prescribed for high blood pressure, anxiety, and heart conditions. Propranolol, atenolol, metoprolol, they work by blocking adrenaline. Your heart beats slower, your hands stop shaking, your voice stays steady during presentations. Sounds great, right? Nope. Beta blockers don't just block physical anxiety. They also block your ability to feel excitement, joy, and even anger. You become emotionally flat because your body never gets the signal to feel anything strongly. Patients report losing interest in hobbies. Sex drive disappears. They feel like a passenger in their own life, watching things happen without actually caring. The trade-off is real. Less panic, but also less passion. If you're on beta blockers and feel like a robot, ask about switching to a different medication or a lower dose. Some people do better on calcium channel blockers instead.
Statins lower cholesterol. Lipitor, Crestor, Simvastatin. Millions of people take them every day to prevent heart attacks and strokes. They work by blocking an enzyme your liver needs to make cholesterol. Here's what your doctor might not have mentioned. Statins can also lower your serotonin levels. Low serotonin is linked to depression, irritability, and aggression. Studies show that people on statins report feeling more angry, more easily frustrated, and more likely to snap at loved ones. Some describe it as a short fuse they never had before. The personality change is subtle at first. You think you're just stressed. But over months, friends might ask why you seem so negative all the time. The fix isn't stopping statins. That's dangerous. But switching to a different statin or adding a CoQ10 supplement helps some people. Talk to your cardiologist. Don't just suffer through it.
Benzodiazepines are prescribed for anxiety and insomnia. Xanax, Valium, Ativan, Klonopin. They work by enhancing GABA, a brain chemical that calms everything down. Within an hour, your racing thoughts slow. Your muscles relax. You feel safe. But here's the truth. Long-term benzo use changes your personality in ways you won't notice. You become more passive, less curious, and more emotionally numb. Decision-making gets harder because your brain stops practicing how to handle stress without the drug. Patients describe feeling like they're watching their life from behind glass. They stop initiating plans. They stop caring about hobbies. And the worst part? Benzodiazepines are highly addictive. Your brain builds tolerance fast. You need more to get the same calm. And when you try to stop, withdrawal causes rebound anxiety that's worse than what you started with. If you've been on benzos for more than a few weeks, talk to your doctor about a slow taper. Don't quit suddenly. That can cause seizures.
Corticosteroids treat inflammation. Prednisone is the most common one. They're used for asthma, allergies, arthritis, and autoimmune diseases. They work by suppressing your immune system, but they also flood your brain with stress hormones. The personality effects are dramatic. Up to 60% of patients on high-dose steroids report mood swings, irritability, and aggression. Some develop full-blown psychosis, mania, paranoia, suicidal thoughts. Family members often notice it before you do. You might feel completely fine while screaming at your spouse over nothing. The scary part is that steroid-induced personality changes feel real. You don't know you're being affected because your brain is convinced your anger is justified. The good news is that these effects usually reverse when the steroid dose goes down. If you're on prednisone and people keep telling you that you seem different, believe them. Call your doctor. Don't wait.
Anticholinergic drugs block a chemical called acetylcholine. That's a neurotransmitter involved in learning, memory, and attention. These medications include some antihistamines, like Benadryl, older antidepressants like amitriptyline, bladder control drugs like oxybutynin, and Parkinson's medications. Here's the catch. Long-term use of anticholinergic drugs is linked to cognitive decline, brain fog, and even dementia. The personality change looks like early Alzheimer's. You forget words. You lose your train of thought mid-sentence. You become confused in familiar places. But it's not dementia. It's the medication slowly starving your brain of acetylcholine. The scariest part? Many people take these drugs for years without anyone connecting the dots. Their family thinks they're losing their mind. Their doctor prescribes more medication for the confusion. The fix is simple. Ask your doctor if you can switch to a non-anticholinergic alternative. For allergies, try loratadine. For depression, ask about SSRIs instead of older tricyclics. Your brain fog might clear up in weeks.
So, those are 6 medications that can quietly change your personality. Not because you're broken, because chemistry is powerful. If any of this sounded familiar, don't stop your medication. Talk to your doctor first. And if you've experienced a personality change from a medication I didn't mention, drop it in the comments. Other people need to know. I hope this helped. Give me video ideas you want to see next.